Oswald is our newest generation of simulation mannequin that we use in the health sciences department, and we're thrilled to have this kind of technology. What this has allowed us to do is to be able to utilize simulation anywhere throughout our community.
Let's see. We've been taking his vitals every 15 minutes.
I think it's too. In the past, our mannequins have been pretty much tied to a room because they had to be tethered to compressors and electricity, and this mannequin is totally self-contained, so we can put him in the middle of the soccer field and utilize him for a teaching scenario with our groups of students. And we use this mannequin in all of our programs here at the college in health sciences. Oswald was born in Texas at the Laredale facility, and he arrived here via, I think, the lovely accommodations of UPS about 2 or 3 months ago, and he's been acclimating to the culture and climate of Grand Junction. The simulation environment is set up to create reality for the students, and it's an opportunity for them to practice responding to a situation without having instructors around. They have to critically think their way through a situation with the patient. While they're doing that, the mannequin is responding to what they're doing, and the instructor, the clinical faculty, are in a separate room. They can hear and see what's going on in the simulation lab, and then they can make the mannequin respond because it's connected to a computer. So if the student gives the wrong drug, they can have the mannequin's heart rate go up or down, or the mannequin can die, or the mannequin can talk to them and say, "That hurts." And so it can become interactive with the students, and they can learn, and we want them to make their mistakes here so they can learn from them before they're working with live people. Oswald can talk. Oswald breathes, has a heart rate, has sounds in his tummy. His eyes can dilate, his lips can turn blue, he can sweat. He also can simulate his symptoms internally. So, for instance, maybe he's a poisoning victim and his airway is constricted. If the students were going to go in and try and put a tube in his airway, they would have difficulty putting the tube in because his internal body would actually simulate the symptoms of what his illness is. He has heart sounds, breath sounds, he has EKG. We also can utilize monitoring equipment similar to what you'd see in a critical care and intensive care unit. So you could see like the amount of pressure in his heart chambers. So it's very sophisticated. Well, he's definitely had more than 9 lives in terms of being a cat. We want the students to learn from their mistakes, but we also oftentimes will take them through a scenario in which the patient is dying. We want them to, first of all, to know how to respond in an emergency if they encounter that in the hospital. But sometimes we utilize him in a scenario in which they have to respond to someone who's in the active process of dying. And so it's a matter of working with him and his family to really nurse them during that difficult time of life. The students love simulation, and they want to do more of that because it is so much more like real life. It's different than teaching in a classroom setting. They can pull it all together there. So what they've learned in their individual pharmacology class, or in a class on medical surgical nursing or physical assessment in the sim lab, that's all integrated into the learning environment. So it's really a time when they can pull it all together. They learn a lot about delegation and teamwork and communication in there. And those are things that are harder to teach in the classroom setting. And in the hospital, students can't do everything that a licensed individual can do in terms of taking orders. There are some things that students can do that are more observational in the hospital because they're a student, whereas in the sim lab, they can be the person actually doing it. Policies, procedures, they have to understand the boundaries of their legal practice, and oftentimes we'll have students with different degrees in different programs. We may have a paramedic student as well as a nursing student in there together, so the RN student knows what their scope of practice is, and that's different than a paramedic. They can do things that we can't and vice versa. We also have different levels of nursing students in there. We might have a practical nursing student as well as a registered nurse student in there. And again, they need to understand where their boundaries end. It's a good place for them to learn that.